Success Insight shares the stories of the people with passion and drive who make things happen in the world. Here's your host, Howard Fox.
Hello, everyone, and welcome to the Mind, Body, and Soul series on the Success Insight podcast. The Mind, Body, and Soul series celebrates the journeys and stories from health and wellness professionals who are committed to helping their clients and patients realize their physical, emotional, and spiritual courage and well-being. Our guest today is Dr. Richard Goulding. Dr. Goulding is a physician and surgeon. He received his medical degree from Loyola University of Chicago, the Stritch School of Medicine, and trained as an ENT-otolaryngologist. I hope I got that right. He specialized in disorders of the head and neck, ranging from facial plastics to cancer. He is presently the chairman and chief medical officer at Gold River Productions, a medical nutraceutical company, and the company is focused on developing products targeting specific disease states as supplements. Dr. Goulding is also, believe it or not, when he isn't practicing, he's written novels and screenplays, and really just a very interesting individual. So Dr. Goulding, it's a pleasure to have you on the Mind, Body, and Soul series on the Success Insight podcast.
Thank you. I appreciate it. As far as the interesting part, I'm not sure about that. Ask my wife. She has a different opinion.
I would have to think that at least your wife says, at least he's busy. He's not hanging around the house bugging me all the time.
I don't know if that's good or bad, but we'll see.
Sounds good. Well, hey, thank you for taking the time to join us today. And, you know, what I loved about the work, or where this started, is this whole area of CBD, these nutraceuticals. And I would love to chat about that. But beforehand, if you could just provide our audience with a little more background. I've alluded to some of this, but you're a medical professional. And how'd you tell us a little bit about this journey?
Well, the journey began for me around the year 2000 when I suffered some problems with my eyes, so I couldn't do technical surgery because of depth perception issues. So I had met a gentleman who happened to be a nutrition expert and a chiropractor by the name of Bruce Bond. And he opened my eye to a different side of medicine than MDs usually get. There's always been a conflict or a diverging opinion, if you will, between chiropractic practice and MD practice. And I never really understood that until engaging, with him and discussing this in general. So it opened my eyes to a different side of medicine. And frankly, I've learned more about medicine since I've stopped practicing it, per se, than when I was actually practicing it, because I just never had time to look into the other side of it.
When you were going through medical school, how much time was devoted to these other aspects, if at all, that you suddenly had a vision to learn more about? Was this new for you as a practicing physician and surgeon?
Completely, yeah. There's zero time spent on nutrition or supplements. It was pretty much poo-pooed at the time, or not even discussed. My son's in med school now, and he's going through clinical rotations. And if he brings up on rounds, even a hint of a diverging opinion aside from the pharmaceutical one, he's ignored. They don't listen to him. They just poo-poo it. So it's still there, this prejudice, as it were, but I think there's good reasons for it. I think most of the nutraceuticals on the market are crap. They do no good. People still buy them. We set out to make something that was different, to make something that when you took it, you felt or saw the difference immediately. Otherwise, I wouldn't be involved with it. So that's exactly how we focused our company and our products.
It's interesting. So I live here in Nevada, a suburb of Las Vegas. And if I drive down the street to one strip mall after the next, there is a storefront selling CBD product. And if I go online, God forbid I go online and do a Facebook search or a Google search, all of a sudden I'm inundated with all of these products. How does the work that you're doing, Dr. Bond's doing, the company is doing, how does it differentiate between what from my perspective is readily available as I walk out the door versus the type of work and the product you're working on to develop and to bring to market that really is targeting those specific, I don't know, issues, diseases, however you would chat about that?
Well, according to the FDA, this is treated as a supplement. So theoretically, it can't target a specific disease state, et cetera, or else it would be classified as a pharmaceutical. I predicted what would happen with the crash and burn and then resurgence of the CBD marketplace when it first came out, because everybody was getting into it as the new best thing, but nobody knew what the hell they were doing. I saw stuff happening from gummies made with 2 milligrams or less of isolate CBD to just, nonsense about mythical cures that it would represent as well. And it was just a jungle out there. So a lot of it is the practitioner's fault, and a lot of it is the government. Years ago, a friend of mine came down with a pretty bad disease that was called polymyalgia rheumatic, or PMR. And it basically involves muscle pain and atrophy and is treated with steroids. And when I saw him, he had lost 50 pounds that he didn't need to lose. And his doctor had placed him on 80 milligrams of steroids. Now, why is this important? It's important because I realized that was the only tool they had. Doctors gave him prednisone. And I told him that what you can try to do is have a full spectrum CBD, a lot of it, and try to offset the prednisone so that at least you can scale down the prednisone, because his doctor said, well, let's wean you from the prednisone, which essentially, basically we're going to take you off the prednisone until you become symptomatic again, and then we'll put you back on a smaller amount. He says it's not a cure. So I started looking at the solutions for him, because I figured he was going to need about 200 to 300 milligrams per day of full spectrum CBD. And we started pricing that in the available commodities that were available online, et cetera. And it turned out to be about $300 a day that he would need to spend to get a semblance of what I called a therapeutic support. And instead, I went out and got him a kilogram of CBD, of full spectrum CBD, and was able to wean him essentially off prednisone from that. And it was a cost-effective way to do it. So I wanted to develop something that was proprietary for a physician or a medical practitioner, as it were, to utilize as a tool instead of prednisone, that would give them ample ability to deal with these issues, much as I described in this particular patient. Something to counterbalance the only thing they had to use, which was at that point prednisone. That's it. So we did that, and we did it for a number of different entities, one of which includes pain. So I hope that explains how we started this and where we're winding up.
Sure. And it brings a question, and in my mind is the stores, again, that are out on the street. At the end of the day, it sounds good, it's cachet to hey, I'm going to go get my CBD gummies, but in reality, I would imagine the levels of the and you're going to explain this to me, I know, the chemicals, or I'm sure there's a lot of different chemicals that make up the CBD itself, but what we buy in the stores is nowhere near the type of therapeutic amount to really actually aid somebody in some of the issues they're facing?
In my opinion, yes. But again, the FDA prevents us from discussing therapeutic effects of this thing until this is, quote, proven, end quote, that sort of thing. But okay, it's like anything else. The nutraceuticals that are available on the marketplace today are tinctures, pretty much. In other words, let's say I I have an herb, okay? And maybe I take a little bit of the root of that plant and put it in my compound, the nutraceutical compound. The FDA is okay with that. I say, well, that's an herb from this plant. It doesn't matter that the true effectiveness comes from the leaf. It doesn't really matter because all that's on the label is that it came from that plant. And then how do you extract the most efficacious stuff from that plant and then take that and compress it down and put it into something that is easily palatable? So there were several problems that we went through in manufacturing nutraceuticals. It was very hard to find a manufacturer that would extract the amount of chemical that we wanted and then put it into a form that is available, easily consumed, and not, a whole bottle of junk that you have to keep taking. My partner is he was the head of marketing and physician instruction for one of the largest nutraceutical groups in the world. And ability to formulate and compound is just unparalleled. So we went through this process and we created these nutraceuticals, and they combine with the rare cannabinoids in appropriate concentration to have the overall effect. So cannabinoids, CBD, is a component. It is a tool. A surgeon can't work with just the knife most of the time. Although I will tell you, my former mentor down at Jackson Memorial Hospital is a guy by the name of Ryan Chandler. And may he rest in peace. But I still remember his wisdom to this day. But I remember doing a neck opera. It was a radical neck. And he said, here. And he gave me a knife. He said, that's all you get. I said, what? He said, yeah, you got to learn how to just do this operation with a knife. I'm like, okay. So he made me use the back of the knife. He made me use the handle, just for dissection and stuff. And I was able to do this operation with the one instrument without having to change back and forth different instruments and this and that. And it made me a better surgeon. So I'm sorry, I went off on a tangent. But the point is that we have all of these tools and we're not utilizing them for a lot of reasons. So what we did is make a core 6 components. 3 of them are CBD based in a very high quantity of the rare cannabinoids and in proper formulation for specific entities, and 3 nutraceutical compounds that in combination with the cannabinoids get the effective results. That's what we've formulated.
That's fascinating. And the base product, the plant, the leaves, are those grown here in the U.S. or do you source those out from other countries? How does that?
Most of them. In fact, one of the components that we've utilized in the past and we utilize now is something that the Vikings discovered growing on top of a mountain. They discovered this plant, rhodiola, and they figured it's all the way on top of the mountain. It's the only thing growing. If we eat it, maybe we'll get stronger. And it was true. And they did consume this thing, and it gave them endurance to a significant level. So there's fascinating history behind a lot of these things. But again, the labeling that you're going to see on our nutraceuticals it just basically shows the formulation, the ethanol extraction, the huge quantity of material that went into these things. It's totally different than anything you're going to see on the shelf of GNC, for example.
It's funny. I knew you and I were going to be chatting today on the podcast, and so I went to my local UPS store where my packages get delivered, and right next door is a GNC. And I was actually thinking, I don't even want to go in there because I know I'm going to be sold something that has, 100 different ingredients on the label, which I can't even pronounce. And heaven knows what the efficacy of those products are. So I'm glad I didn't go in there.
But you should, because that is the most fascinating field, the nutraceutical market, because it's vast, billions and billions of dollars. But people actually buy these products and continue to buy these products without experiencing anything. No relief, nothing. They have no idea why they're buying it and get no benefit from it. I can't imagine a market like that. It makes no sense to me. None.
I get you. And I'm curious about the production. I mean, you have alluded to the sophistication of the sourcing of the material, the raw material, the production. Is how did that process come about? Was this just because your partner, Dr. Bond, he understood how to produce the nutraceuticals, or how did you find the one lab or the two labs that understood what your vision was and was able to say, we can do this, we can work with you? How difficult was that?
We went through over 20 manufacturers, and most of them are so busy making junk that they just weren't interested in going through these extra processes, making that commitment. And we were very fortunate to finally wind up with one that is terrific. And the compound that they sent us, in fact, I called them up because one of the formulations that we had was Painplex. So Painplex is obviously its namesake, but it works in conjunction with our raspberry relief gummy, which supplies CB1, CB2 receptors, and Painplex is a nutraceutical combination that covers the rest of the pain receptors pretty much. So it works very well. But anyway, they sent me these sample capsules after the R&D was done, which we paid for. And I noticed that a few of them had discolored the capsule. It was a plastic capsule. And I called them up. I said, "What's going on?" He says, "We made these things so powerful that that they're actually combined. They actually cause that sort of reaction. They fixed it, and they had to add some calcium carbonate or something like that. But they said they've never made anything like this. That nobody cares. Nobody talks about efficacy, and that's what I think we have to be focused on. So why would anybody want to buy a product that didn't work? I still can't figure this out. Well, we've got stuff that actually works. We have a gentleman that we gave some samples to, and he's a retired NFL player. 4 knee surgeries, 4 joint replacement surgeries, constant pain, been in chronic pain for 35 years. I gave him a sample of our Painplex and our raspberry relief gummies. And he calls me the next day and he says, "Doc," he says, "when you first gave me this stuff, I thought you were full of," well, you know what? I can't say it on the podcast, I guess. But anyway, I said, "I'm glad you felt that way, to be honest with you. I didn't want the mind to take over." He said, "Last night was the first night's sleep I've had in 35 years. He said,
Wow.
I have no pain today. I have not had that in 35 years. He said, I don't know what's in here, but don't stop producing it." And the next day was even better. And so he's a coach, and now he's able to perform his duties and stuff like that. He calls me all the time, but it's nice to hear that. That's what I want to hear. I wouldn't want to put a product out there and say, "Hey, this is going to work. Try it, and you won't feel anything for 3 months." Maybe, that's the part that I didn't want to do.
Excellent. I can imagine with a football player, they've, even after a season, they've got injuries that are going to be with them, for
Forever.
the rest of their life.
That's true. That's true.
How did you begin to, and you just alluded to it, to kind of test it? You gave a sample to this football player, the coach. How do you begin to take the formulations, test the efficacy with an individual, and say, "Yeah, this is doing what it's supposed to do"? And how do you go about doing that in this kind of a development life cycle?
The compound was developed by Dr. Bond, who had worked in medicine for 25 years, and his clinical experience involved taking taking the herbs and combining them and then giving it to the patient in some form or another, and I'm not going to call it trial and error because this is not, it's not new, but to enhance the formulations and to get his knowledge into the formula, and then to take modern chemistry to actually put it into a pill form, where you take that liquid extraction from the ethanol and then you convert that into the powder form, and then you put that. That's the unique part. So we're in the right place at the right time. We've got an opioid crisis that doesn't have any end in sight. The government's answer to that is to restrict everybody's use of narcotics, which is the only thing we know of that deals with pain. So the doctors can't prescribe pain medicines much anymore. People are having surgery with nothing. A tonsillectomy patient from a friend of mine I heard the other day, 12-year-old daughter. They gave her 3 days worth of codeine for his 12-year-old. And they told her, don't take any of this for a week because the second week's worse. Now, it's a painful operation, that tonsillectomy. It's horrible. It just is. It's just, they rip the tonsils out. They leave that bed open in your throat. You're supposed to swallow after that.
Oh my.
So it's almost cruel what's going on today as far as the government control over this thing. So it's a solution that needs to be there.
And how are you and your partners communicating the solution? Because I mean, it sounds, I mean, it's fascinating, great, and I would say, you know, in the last 5 years, I think it was probably 2016 or 17. I had a radio show at the time, and I interviewed a gentleman, lived in Colorado, and he was like would cut grass for people, landscaper, that's what it was. And then he decided he loved landscaping in Colorado, and he went and bought land and he started growing medical grade marijuana. And that's where he was supplying the materials for. And the interest in, and you talked about this early on, everybody got into it. You know, the locals, the folks that really were maybe, you know, the folks that would go to Woodstock, you know, the first, and then you got the business owners, the investors, and then government eventually wants its cut, and it gets harder and harder. So how did you begin to pull away from the crowd, and how do you see staying ahead of the crowd to provide this kind of service to, you know, the folks that need this kind of a product? I mean, how do you stay ahead of that kind of a curve?
Well, I you know, it's basically going to be the first products to deal with pain that's out there. In the nutraceutical world, you can't really patent anything because you just add a little bit of eye of newt or wing of bat to your formulation, and then you've got your own formulation and stuff like that. But it's so difficult to make these things, and it's expensive, and it's hard to find manufacturers that we're going to be ahead of the curve as far as that's concerned. I would think that there's always room for improvement, and this is something that we'll see in the future. Maybe, you know, there's something down the line that'll be even better than this. We opened up basically we give away a lot of our formulations. We give a lot of our material away. We have a 501c3 company that we're associated with called Epidemiologic Solutions. And basically veterans that are in pain, discomfort, we give them the pain gummies, which is what we have right now. And some of them I've even given the nutraceutical compounds to. It's our goal to help them on another level. I've gotten emails and thank yous like you can't believe from people that we've taken out of pain after years and years and years of severe disc pain, et cetera, from just the use of the gummy. And we can do even more with the combination of the Painplex formula. So we're going to help people along the way. We've got a formulation that works. Whether somebody comes in and adds something to it, well, that's fine. I'm sure something's going to happen down the line, but we know we're headed in the right direction because people have told me just that.
Excellent. And one question, the medical practitioner that's going to be recommending these these nutraceuticals? Is that going to be a highly trained practitioner like like yourself, Dr. Bond? Who are those practitioners?
Well, that's a good question. So we're fulfilling a niche. We're fulfilling a vacuum here. Chiropractors have always had a different mindset than MDs for reasons that I'm not going to get into now. But MDs were always reluctant to do anything outside of the pharmacological, compounds. They always felt, and with good justification, that nutraceuticals didn't do much. And I agree, they don't, not in the way they're currently made and distributed. So what do they have to give their patients? The medical mindset, which is my mindset, I wanted to empower physicians, chiropractors, homeopaths, osteopaths, physical therapists, acupuncturists, with something more. What else can they do for the patient? The mindset now, it's mind-boggling to me. Well, can't give you any more. That's my limit. Done. It's just, I can't practice. I couldn't practice like that. It doesn't make any sense to me. And they're looking for solutions, at least along pain, sleep, anxiety, energy. The formulation that I spoke to you about for energy, I mean, it takes it to a new level. It's not caffeine, it's not sugar. It doesn't give you that sugar or caffeine high, but it gives you endurance. And it gives you increased awareness and focus. That's something that I think is very unique to the marketplace. So while it would be best coordinated for a patient with a physician, it doesn't have to be. And while chiropractors have pretty much been limited to what they can do for a patient as far as these issues are concerned, including pain, now it empowers them with these formulations to help a patient, besides whatever they can do internally in the office, to something more of an approach that is for the patient. The nutraceuticals deal with the central cause of pain. Narcotics don't. The CBG and high CBD gummies deal with the CB1, CB2 receptors of the brain. It's just a different formulation, but when you grasp the totality under and understand that they both work together, and it would be coordinated and recommended by a physician or a chiropractor, I think that's a great approach. And the results speak for themselves with this. So I don't know where it's going to go in the future. It should be available to the public, but how does the public know what to do with this stuff? How would they know?
Well, yeah, and it's certainly not, go into GNC and pick out which one you want. That's
what they're doing.
Not the way to go.
It's exactly what they're doing. Maybe they get what's on sale. Maybe they get, whatever.
Doctor, would you be open to perhaps coming back onto the podcast just to perhaps chat about the issues that these products are addressing, perhaps go in a little bit more detail? Because in the time today was just an overview.
Sure. A lot of it will be explained on the website, which is grpsinc.com, Gold River Production Services. That's the website. It does explain a lot of this. There's a lot of useful information. Some of it is, it's not going to be on there. And I welcome questions. It can be done through the website as well. And certainly I would welcome more. This usually opens up doors to a lot of questions from professionals and non-professionals alike.
Okay. Yeah, I think, definitely we're going to provide the backlinks to the website. And I would love just to continue to learn more with you. And, maybe the next episode would kind of go into the products that are being produced. Because to me, it's fascinating. I don't know if you can tell our cameras are on, but I'm a little bit overweight. I guess that's what they call inflammation. But
it's the camera. They all do that. It makes me look 100 pounds overweight.
I was wondering what the issue was. All right, that's great. Hey, before we kind of close down today, I am curious a little bit something about you. As I was doing my research, and I was spending quite a bit of time yesterday on Google, I discovered that you have written a couple novels. There's a screenplay. Tell me more about that. When did you have time to do that?
Well, writing has always been a passion of mine. I've always enjoyed it. One of my neighbors was a best-selling author. He is a best-selling author, international author. His name is Steve Berry. And Steve and I became very, very good friends. And he writes mostly historical fiction. And he took me under his wing. And it's like anything, when you're fortunate enough to deal with experts in their field, if you don't listen to them, then you're a fool. But he's a phenomenal teacher and a great writer. But he actually had a course that he taught. People, I can't remember what the price, they paid maybe $800 to listen to him. And these are would-be writers, fiction writers. And part of the course offered people who attended, he would read their first chapter and one-on-one, and he would critique it for them one-on-one. So of the 38 people that signed up for his class, one person made that request for him to look at.
Wow.
And it's just, it's interesting. You learn from it. I learned from my next door neighbor, the chiropractor, and we've had discussions along the line. You grow with this stuff. So to ignore whole areas of medicine or writing or anything, it's just foolish.
That gets back to your mentor, and here's the knife, and go do this procedure. The same thing with with Steve Berry is like, here's an opportunity. We're going to read this chapter, and you're going to come away with some insight, and you get to follow. That's the best part about this type of feedback. You get to decide what you agree with or don't, and and how you take your next step afterwards. It's your choice.
Yeah, I thought it was a pretty good writer until he went through my first chapter, and it was the red lines came in, and then we spent a week going over the first line of the novel. The first line.
Oh my, the first line? Oh,
yeah. And he has a first line contest. So basically at the pitch contest, first line contest, the pitch has to be 27 words. You have to do your pitch in 27 words. Any more, we throw you out. We don't listen to you. But these exercises, they really help you to focus on the prize. And the prize in this case was pretty clear to us after a while. And now that we've made the products, we're on the wake, we know that they work, we know they're effective. I want to get as many doctors as I can on board. We're going to incentivize the first tranche of them, though. Right. They're going to be happy with this. And it's just an alternative way to looking at dealing with a lot of problems.
I love it. Doctor, thank you so much for joining us.
My pleasure.
On the podcast. And again, I'd love to have you back. Maybe we'll take a little deeper dive into the components, but this has been a great start. So thank you again.
Thank you.
All right, folks, we've just been chatting with Dr. Richard Goulding, a physician, surgeon, medical officer at Gold River Productions, a medical nutraceuticals company. And we have been focusing on their development of products that target states, pain, anxiety, energy, and those products, just a new at, perhaps modern medicine. And so happy to have Dr. Goulding here today. Really excited that he's open to coming back and joining us. Maybe we'll take that deeper dive, and always love to hear stories about, the changes that have taken place as a result of, the product, the service. So this is a great segue, especially for our Mind, Body, and Soul series, which celebrates that journey and stories, pursue healthness and emotional, spiritual, physical well-being. So we hope you enjoyed today's episode with Dr. Goulding. We'll provide backlinks to his website, grpsinc.com. And if he's open to it, we'll even provide the backlink to the 501c3 that he mentioned. We'll double check with him on that as well. If you enjoyed today's episode, please let us know on our podcast page, Success Insight Podcast. You can also find us on LinkedIn and Facebook on our Success Insight Podcast pages, as well as the major podcasting platforms, Amazon Music, Google Podcast, Apple Podcast, Audible, and especially Spotify, where we have our Mind, Body, and Soul series. Okay, folks, wherever you are, whatever you're doing, go out there, have a phenomenal day. Take care of yourselves, your family, wear the mask if it's important, practice social distancing if it's important, but above all, make a difference. And we will see you on the next episode of Mind, Body, and Soul and the Success Insight podcast. Take care now.
Success Insight is a production of Fox Coaching and First Story Strategies. Find us online, successinsightpodcast.com.